Hello there and welcome. It's the Fly for Doctor. So today we're going to be talking about deep vein thrombosis, or better known as a blood clot. We're going to break down what causes it, what are the signs and symptoms, things that you can do to avoid it, and what to do if you may find out that you have it or you think you have it. I'm the Fly for Doctor Show. I am a foot and ankle surgeon, a specialist that practices out here in Houston, Texas. If you want to see me personally, visit our website and book an appointment, either virtually or in person, or give us a call, 832-415-1790. If this topic interests you, stick with me and let's get into it. Well, what is a deep vein thrombosis or a blood clot? Well, a blood clot is what happens when the blood that is supposed to be flowing in your veins decide that they don't want to work anymore, they don't want to move anymore, they just form a clot, they congeal, and they are stuck in that area. Well, we know that we've heard about it, but is a clot really bad? And my answer is no. A clot in itself is not bad. However, we don't want it to form in our vessels. We want it to form when we're cooking dinner and accidentally slice our hand. Oh gosh, and we've heard about that. We've watched Food Network. We've seen the cooking shows where there's a little cut in the neck. Well, we don't want those patients or those people to bleed out everywhere. We don't want to bleed out when we just scrape our knee or, bump our elbow or something like that. We want our blood to clot and heal. So clotting in itself is not a bad thing. However, when the clot is forming in our vessels, well, we don't want that, because unfortunately there are very, very bad side effects that could happen if they form these clots in our vessels. So now we know what a blood clot is. Well, why do they form? Why will someone have it and some other person not have it? And here's what I'm going to talk about: the risk factors for why you, yourself, your family member, your brother, sister, mom, dad, anyone that you know may have a blood clot. Women, especially those on birth control, have a higher chance of getting a blood clot. Also, women who are pregnant or shortly after giving birth. These patients also have an increased risk of having a blood clot. Trauma. So if you had an accident or anything like that, the clot could form, when you're bleeding, and that blood could form in your veins. Or if you're traveling either by boat, land, sea, or whatever, or the air, I forgot air, and you're sitting for an extended amount of time, over 2 or 3 hours, and you haven't moved, you may have a chance of getting a blood clot. If you also have diseases that let your blood clot unusually fast and abnormally frequent, then you already know that you have a blood clot at a drop of a dime, and so that already increases your risk factor. Patients who have diseases like diabetes, high blood pressure, hypertension, or even have undergone cancer treatment could also have an increased chance of having a blood clot as well. Patients who are obese or sedentary, because they're not moving frequently, that will usually cause the blood to slow down in their arteries, in their veins, and not move as frequently as it's supposed to. And the one that is the most controllable is smoking. Smoking, it also increases your chances of blood clot, and if you watch any of my videos, you already know how I feel about smoking. And if you watch one of my other videos, I even give you a trick on how you can quit smoking. Now, it is important to know where these blood clots form. I know you may have seen people who have these veins on their legs. Those are varicose veins that happen on in the superficial vessels. So they're superficial and deep veins. The superficial veins are the ones where the valves aren't working. You see them torturous looking, and they're on the skin. But the deep clots are in the deep veins. We don't see those. They're deep and hidden within the muscles and hiding in this cushy area. But we don't want those to move. One of the 3 most important things that we do when we're trying to take your blood clots is to make sure that a chip from it doesn't dislodge and go anywhere else, or the whole clot does not dislodge and go anywhere else, and that we try to reduce the size of the blood clot. So we've talked about blood clot now. We've talked about how it forms, what are the risk factors for having it, but what may incline you or clue you in to thinking perhaps this may be a blood clot? Well, let me answer that for you. One of the most frequent symptoms is leg pain. So let's say you've been traveling, or you've been sitting for a while, or you're pregnant, or you're on birth control, or any of these risk factors that I talked about, and all of a sudden you start to feel pain. You start to feel pain in your legs, and it's just hurting tremendously, and you cannot seem to figure out why. Well, you may want to be checked for that, because leg pain, swelling, like tightness in the legs that looks like a balloon is about to pop, that could be a sign. Sometimes also the affected limb could be warm, or the arm, because it could happen in the arm as well as the limb. It could be warm and just painful and tight and things like that. So warmth, pain, swelling, discomfort, all of those are actually signs. And if you start to see those signs, I urge you to go to an urgent care, your primary care doctor, or even in worst cases an ER. They would do a blood work to check to make sure that there is no blood clot, as well as a venous Doppler, which is where we look inside your vein, sort of inside, but through the skin and tissue in your vein to see if there is a clot there and rule that out as a cause of the symptoms that you may be having. Well, okay, so now you have a blood clot. Well, what's the big deal? Here is the big deal, honey. The big deal is the most lethal side effect of having a blood clot that dislodges is that it dislodges and goes in your lungs. Now let me break it down to you like this. The lungs, they exchange oxygen. So you breathe in oxygen, it goes in your lungs, and the lungs is like, oh, I have a work to do. I have to put oxygen that you just breathed in into this blood. And then you have a clot that is blocking the flow, okay, of air in your lungs. Well, this air, you can breathe all you want. This blood is kind of stuck there. It's bad traffic. It's not moving. Things are not moving. And all of a sudden, patients are short of breath. They feel a tightness in their chest. They feel like they can't breathe. It's just horrible, and it is life-threatening. It is absolutely life-threatening, and that is why it's so important to identify if you have a blood clot or not. And that's why we talk about blood clot or DVT, and we manage it as soon as we know that it's there. Healthcare providers will give you medications to try to take care of it. Again, to prevent it from getting any bigger, prevent it from chipping or dislodging and traveling anywhere else. So a pulmonary embolism, which is what I just explained, where the lungs has clots in them, is one of the most lethal side effects of having a blood clot in your legs or your arms that have dislodged and gone to your lungs. The next one is chronic venous insufficiency, and that is where you have this blood clot that's just kind of been chilling for a while. Now there is just steady traffic. There is steady traffic in the blood flow that's going in your veins. We can't get it back to the lungs, and guess what? Unfortunately, gravity is working against us. So because we're standing, or the legs swell, there's a clot that's preventing blood flow, and that chronic venous insufficiency is what happens. The veins are just not working appropriately, and these typically happen with the deep veins. And then the sequelae of that, what happens after that, is post-embolic syndrome, where this blood has been chilling in the veins and the legs are swollen, you can barely walk, they feel like tree trunks. Next thing you know, the water got to go somewhere. The blood has to go somewhere. So it starts to seep out of the vessels into the tissue around it. And guess what? It starts to come out through the skin. If you've seen any of these videos on TLC, these health videos, you may, or even just YouTube something, you would just, if you look for chronic venous insufficiency or post-thrombotic syndrome, you will see the swollen legs, they're draining, and it's not blood that's draining, it's clear fluid. They wear their socks and it's soaked. They wear on their sheet and it's all soaked. All of that is just the fluid trying to get out. It needs to get out somehow. The skin becomes stained and discolored with, this brown, red, deep red kind of coloration, which we call hemosiderin, that is being placed or deposited on the skin. Sometimes they may even have wounds that doesn't heal. It's just continually weeping and weeping. All of these are sequelae or side effects of having a deep vein thrombosis. So what are some of the things that you can do to help prevent deep vein thrombosis or a blood clot from happening? If you're going to be traveling, make sure that you're not seated for more than 2 to 3 hours. Make sure you're moving. If you're not able to move based on where you are, try to squeeze your calf. When you squeeze your calf muscles, what that does is it moves blood back and forth. Move your ankles, rotate them, move your knees, rotate them, squeeze your calf. All of that are muscles that are moving. All of that will push the blood in the vein up and down, so it's not stagnant and forming a clot. Better yet, walk. If you can walk, that would even be perfect. If you live a sedentary lifestyle or you're obese, just exercising or walking and moving will help to prevent blood clots and help to aid the flow of blood in the vessels. Now, eating a balanced diet is always great and is always advice for every situation that we have out there. Also, drinking lots and lots of water. That'll help increase your volume of fluid in your body and help to increase the blood flow as well. And of course, like I always say, smoking. Stop smoking. Now, like I always say, I know it's hard to quit cold turkey, so I've given a trick about how to quit cold turkey. If you know that trick that I talked about, leave a comment down below and share that trick with other viewers so that they would also learn from it. I would really appreciate it if you do that. But these are the things that you can do to prevent a blood clot. Also, wear compression socks. That'll help to push the fluid through your veins. If you're going to be traveling and you're going to be seated for a long time, a compression socks will be super, super awesome. And loose clothing over the compression socks so you're not choking the life out of your legs. All right, this was a quick video, I think, about blood clots, but we talked about what a blood clot is, why it forms, some of the risk factors, and some things that you can do at home. Of course, the things that a doctor could do is give you medication to, thin your blood or even pop the blood clot and kind of break it down. Of course, if all of these fails, there are also surgical options for that. But for here on this channel, we're not talking about the surgeries that you can have. We're just talking about things that we can do at home to try to help. Which one did you learn and which one of you be incorporating in your lifestyle? I would love to know. Leave a comment down below. Did you benefit from watching this video? Did you learn something and did you think it was insightful? If you did, would you consider subscribing to our channel? I'd really appreciate it. It'll help the YouTube algorithm share this video with people who really may benefit from it. Also, would you please hit the like button if you like this video and share this video with your friends, family, someone who may absolutely benefit from this. I'm the Fly for Doctor Show. I am on Instagram as well as TikTok as a Fly for Doctor as well. So if you want to leave me a comment or a DM in any of these platforms, I'll really appreciate it. If you want to see me personally or virtually, also visit our website and book an appointment or give us a call 832-415-1790. I appreciate my time with you guys. Thank you so much for watching till the end. Till next time, have a great day. Bye.